Hi there, Kate Medina here, endeavoring to talk about our discussion post for this week on dual relationships. The references that I used for this discussion are the ACA 2014 Code of Ethics off of their website, counseling.org. And I used an article titled Rural School Counselors' Experiences with Dual Relationships, and that's by DeCino, Walks, and Iverson. And then I also referenced our regular textbook, Ethical, Legal, and Professional Issues in Counseling by Remley and Herlihy. So in our textbook, boundary setting within the counseling relationship is aptly referred to, and I quote, as limits that promote integrity. Or otherwise, they're well-purposed boundaries that are set, clearly communicated, and executed in order to prevent negative outcomes. As expected, dual relationships or relationships where counselors take on two or more roles simultaneously with a client can be nuanced, complex. They can evolve subtly, and they can sometimes be very difficult to recognize. Dual relationships are not exactly unethical, but counselors must be cautioned that the slippery slope phenomenon that's mentioned in our textbook, or otherwise the gradual erosion of boundaries between the client and the counselor, can harm the client, and it can also lead to ethical violations. In the counseling relationship, the professional counselor must remember that intimacy goes one way only. And often when counselors engage in a dual relationship, they can blend their roles and create a conflict of interest that can in turn then compromise their objectivity. The article Rural School Counselors' Experiences with Dual Relationships gives a great example of what a dual relationship can look like. The article talks about, first it defines a relationship in which a school counselor is concurrently participating in two or more roles with a student. That's the way they defined dual relationship in this context. So for example, school counselors that live in rural areas, so smaller geographic areas, they tend to have frequent interactions with their students or their students' parents or family members that happen outside of the academic setting, simply just due to geographic isolation. So they may frequent the same grocery store, they may attend the same church, they may eat at the same restaurants, simply because lack of options in a smaller area, you're obviously going to run into the same people more often. They might need their car repaired, and maybe the person that owns the car shop could be a parent of one of their students. So there's just a lot of instances where these interactions can happen in a rural setting. Also, small town school counselors are often required to fulfill more non-counseling responsibilities just due to lack of resources, and it can create even more opportunities for dual relationships to happen between students and parents. So small town living necessitates navigating a lot of overlap in school counselors' professional and personal lives. The ACA Code of Ethics provides many guidelines for counselors to encourage solid boundary setting and ethical decision making when it comes to the complexities of dual relationships. Section A5 identifies the types of relationships that are prohibited, including sexual and romantic relationships with current clients or their family members. Section A6A instructs counselors to carefully consider the risks and benefits of accepting clients that they know from a previous context or an outside context. Section A6B instructs counselors to consider the potential implications of extending their parameters to ensure that appropriate and professional measures are taken to prevent harm to the client, such as obtaining informed consent, consultation with other counselors or supervisor, and proper documentation of boundary extension. Counselors would be wise to consult with fellow counselors or supervisors in situations where a boundary might be crossed. They should always be sure to clearly communicate the parameters of the counselor and client relationship to the client, including discussing what a chance meeting outside of the office might look like and how that would be handled. Also, in instances where clients may reach out via social media. All of these things should be clearly discussed and defined and written down during and probably before the counseling relationship even begins. Also, counselors would do well to remember that they have an ethical obligation to keep their professional life professional and their personal life personal as much as they can possibly separate the two. And they should always weigh the potential risk and the benefits when they think that they may cross a boundary. And I guess probably most importantly, everything should be documented. So dual relationships always pose the risk of harm to a client, primarily probably, in my estimation, from the counselor's loss of objectivity. Because the nature of counseling relationships, there's a power differential that can exploit the individual with less power, which is typically the client. Dual relationships can create incompatible expectations that can pose a risk to the entire therapeutic relationship. So in essence, dual relationships can muddy the relational waters, as blending roles can be detrimental to the client regardless of the counselor's intent. Thanks.